right, we'll call the Health, Human, and Social Services Committee meeting to order. And the first thing I need is approval of last month's meeting. Supervisor McDevitt, seconded by Supervisor Bramer. Any corrections or additions? All those in favor? Aye. Opposed? Carried. With that, Chris, we'll turn it over to you.
Good morning. It's so interesting. I don't come before the committee for 4 months, and then I'm here 3 times in 6 weeks. It's just how it works out. As I had mentioned at the last meeting, we didn't have our annual allocation yet, but we do now. So the first item is request to amend the county budget to add our Title I formula funds. The total this year is $589,862, which is about a 6.5%, almost 7% cut from last year. It really shouldn't impact our programs other than training, and so what we're going to do is continue to look at, outside other sources of funding to maintain our training.
All right, would someone like to make that motion? Supervisor McDonald, second by Supervisor McDevitt. Any questions, comments? All right, all those in favor? Aye. Opposed? Carried. Thank you.
And of course, all the details on that are on page 3.
Right.
On page 4 is a request to host a meeting. This is for the Summer Youth Award Ceremony and Picnic. This year it's actually scheduled for a Wednesday. As most of you probably remember, it's almost always on a Thursday.
Right.
And this year we're moving it to Wednesday because I have a very selfish reason. On Thursday my son is being married, so
good reason.
Like, Chris, do the picnic on Wednesday, you can still come, it's no big deal. So Wednesday, August 18th, and we'll make sure that invitations go out to members of the committee.
All right, someone like to make that motion? Supervisor McDonald, second by Supervisor Bramer. All those in favor? Aye. Opposed? Carried.
And then I had another request to host meeting that wasn't on the agenda, and I apologize. First, I'm going to make a big confession. I didn't seek approval last year, which is why I missed it this year. I didn't remember it until I was preparing for this morning, and that is a request to host the meeting for our youth orientation. We do the youth orientation every year for the summer program. It's scheduled for next Monday, and the request is for food and beverage. We buy them pizza and soda for lunch.
All right. Motion made by Supervisor Bramer, second by Supervisor McDonald. All those in favor? Aye. Opposed? Carried.
And then we had 2 items for information. I'm going to do number 2 first, and then we'll do number 1. Item 2 is the Workforce Development Board. It was scheduled for earlier in June, but I sent an email out to the committee. That was rescheduled to next Tuesday. You're certainly welcome to attend. Just let me know by Friday if you plan to come. It's going to be at the 2nd floor community room. I'll send out the agenda when I get it. I don't have that yet. Mm-hmm. And then, again, at the last meeting, we talked about a presentation on the New York Wired program. The intention was to have somebody from Metrics Learning here. They're currently in California, so they forwarded me the presentation, so you get to hear me instead of them. But the first part of the presentation is a YouTube video. So we'll see how good Amanda is with the...
I do not have the link. Is it just called New York Wired? I can just try searching for it?
Well, there's several of them.
I think that's it.
Do Skill Up America. If we don't find it. Yeah, that first one. Must be quite accurately. I'm not sure if this was the link that I sent you, but there's actually several that give you an overview of what the program is, and I thought this would be a good introduction.
Do you want me to do it? Yes, if you would mind.
Oh.
Just a big dial.
Okay, all right, roll it.
National Development Plan and persistent outreach
Combined with large populations of workers with foreign language barriers, government and corporate leaders are desperate for potential solutions to help boost the talent pipeline. Places like Oswego, New York, Manchester, Pennsylvania, and Orlando, Florida are addressing these issues head-on. They're offering their version of Skill Up America to provide free job skilling to all residents who are unemployed or underemployed. Skill Up America uses Metrics Learning's technology platform to deliver training in multiple languages, including Spanish, Mandarin, and more to help anyone become job ready 24/7 from any location with internet access. The system is designed for all employment and educational backgrounds, whether you're a recently unemployed professional with an advanced degree or a recently released inmate without a high school diploma. Over 5,000 e-learning courses and 100 industry certification tracks are available for a range of skills and occupations, whether training to be an administrative assistant, call center support, or computer technician. Unlike 2008, where there were 7 job seekers for every job opening, today there's usually less than 1 viable candidate. We need to expand the pool of potential candidates to include re-entry, school dropouts, public assistants, incumbent workers, veterans, and other untapped workers. To reach these candidates, Skill Up encourages partnerships with city and county governments, workforce boards, libraries, community-based organizations, chambers of commerce, community colleges, and other agencies. Skill Up America can be offered at all of these locations under one virtual portal. Our candidate matching algorithm will allow employers to recruit from the local talent database. Skill Up America is being launched in several locations across the country. Make your city the next to enhance its talent pipeline today.
I actually like this video better than the one that they sent me, because I think it gives you a better idea. I can't see the corner. There we go. Gives you a better idea, a better overview of what I really wanted to talk about today. And we've been using New York Wired for multiple years to provide training to unemployed and underemployed individuals. We buy licenses from New York Wired, and then we make them available to our customers. And they can go online. There's over 5,000 courses, and we've been doing this for about 10 years. But this is a new initiative that at next week's WIB meeting, we're going to talk about becoming one of the communities that they mentioned in the video. So Skill Up America is the trademark that they are now using under this particular program of New York Wired. And you heard on the video the national challenge. There's just not enough workers for what businesses need right now. There's an increasing supply of jobs, but a decreasing supply of quality workforce. So one of the solutions is the Skill Up America solution to provide low-cost training and certifications for workers that then will meet with the needs of business. Back in 2008, there were 7 job seekers for every job opening. Currently, there's not even one. And I checked this in for our local labor market, and it's always a little difficult when you look at a specific county or even a MSA. But just locally within the Glens Falls metropolitan area, our unemployment rate in April was 5%. There was an estimated 3,000 people unemployed. Just a quick view of Indeed.com. There were just under 2,600 job postings yesterday, including over 1,025 new jobs within 25 miles of Glens Falls. So you can see that even locally, we have a very tight labor market. If all of these 2,600 jobs were filled, we'd virtually have no unemployment rate. It'd be less than 1%. We work with businesses all the time, and there's constantly a need. I can list 5 businesses off the top of my head that together need well over 200 workers that they're not able to find. So the concept is, how do we leverage the assets of the region to then increase the labor supply? And this is kind of a graphic of the partners that we're working with to do that through the Workforce Development Board. We work very closely with SUNY Adirondack. We've been talking to the libraries, community-based organization, the Chamber of Commerce, and of course the EDC. This is just another graphic that shows where the workforce comes from, the intake. Our primary focus is on people who are unemployed. So we're going to focus on people that are unemployed and underemployed or on public assistance. We've been working with DSS to try to help find those people work as well. So the Skill Up America portal is a concept of unlimited licenses, so that anybody within the community can go into this portal and take online courses to improve their work skills. It starts with assessments. There's 10 industry pathways. We talk about career pathways. You start out at an entry-level job and you work your way through to higher level jobs that require additional training. There's measurable milestones. There's industry certifications that you can receive. And we're able to case manage locally in our office. Yeah, go ahead.
So when it's open, does a particular person get access to this, or can anybody anywhere with an internet be able to?
Yeah. Well, right now you come to our office to get a license, but once you have a license, you can take the courses anywhere. As long as you have internet access, you can go to a library, you can do it at home, you can do it at our office. We use our
for your office first.
Yeah, to get the license. But the concept is that there would be, with these unlimited licenses, there would be a separate portal that would be made public so that anybody could go in and initiate. Yeah.
Peter, go ahead. Question?
Oh, I'm sorry.
What type of jobs would this training address? What could you be training for?
Well, again, there's over 5,000 courses. One of the areas that we have focused on specifically is the healthcare industry. There's they call it MedCom through this portal. You don't get to do the field work, but you can do all the coursework. So you would be ready to then go out and do the field work. There's ways that you can go in and you can select the career that you desire, and then it will self-populate the courses that you need to take. It's almost, I don't want to say it's unlimited, but it's almost unlimited. We've done certifications. You can get certifications in Microsoft, QuickBooks, Cisco. There's a manufacturing specific portal for advanced manufacturing. But again, it doesn't involve field work, so you still need the field training.
One of the early slides there talked about, and I'm just trying to understand, it talked about Mandarin. So
Oh, yeah.
So the course is taught in Mandarin for an Asian population that would be in New York City?
Yeah, exactly.
Or here, I see.
Yeah, there's multiple languages. Yeah, we don't see that much need up here, but it's available if the need is there. So this is just a screenshot that shows what a job seeker may see when they first go into the site. There's an area where they list job postings and they link it to Indeed.com. You can go in and upgrade your skills, or you can go in and research workforce services. And then for the employers, there's an ability to post job openings and search for candidates. And we're looking at ways to mesh this with other online programs so that they can expand the number of job seekers. This is what I was talking about, where you can go in and pull up your skills that you're looking to obtain. In this case, they used administration and management. I'm sorry, this is for businesses seeking candidates. There's ways that you can screen for specific candidates, and there's ways for job seekers to screen for particular jobs. You heard on the video they talked about Oswego. They launched this virtual registrations where anyone could go in and take these courses. Within the first month, they had over 400 signed up. Our history with this program, and this is for all 3 counties, not just Warren County, in any given year we have between 300 and 500 people that will go in and complete courseworks. One of the things they talk about is a survey of the capital region, again, that talks about the the number of job openings. They had 185 responses from businesses. They had 2,600 job openings, and 64 businesses were looking for candidates. They weren't able to find them on their own and looking for help with that. They're also launching a similar one in Central Florida, where they had 4,000 registrations per year. And again, one of the target audiences is unemployed and people on public assistance, where they can go in and get new skills that will make them employable. Yeah.
So, is there income on there? They had cases closed to earn income. Is there income level set for this?
So currently, the way our office operates is you can only get training services if you're eligible. One of the eligibility criteria, though, is if you're an existing worker. The Workforce Development Board has set the self-sufficiency rate as $21 per hour. So even though there is an income requirement, pretty much anyone that needs this help is able to be eligible. And again, mostly we work with people who are unemployed or underemployed. That's the vast majority of the customers that we see in our office. But anyway, it's designed to both meet the employer challenges as well as the challenges within the workforce. There's a number of soft skills components in here, so that you would learn the soft skills like showing up for work on time, how to address appropriately, how to behave appropriately in the job setting. There's also ways to connect this with hiring needs. There's 2 examples on the next slide, as well as internal training needs. So if you're a business, you can use this to advance the skills of your existing workforce, as well as to train up new workers. And then this is the example that I mentioned where metrics was used as a screening tool and placement tool for Novelis in Oswego. It was a new business that came into the region, and they first used it as a screening tool, but then the workers that were further interested were then given the metrics courses to take, and so that they were able to pass the screening test and still be considered for the openings that they had. So there's a built-in method so that instead of rejecting job applicants, you can provide the training for them so that they then would have the skills needed for the specific positions identified. So that's one of the final slide here is the ability to do that through remediation. So I may not have given you the presentation exactly the same way the staff from Metrics would, but that's it in a nutshell. And for any questions, since I've been here, it's something that I've always been really excited about, and our office in our workforce development area has actually been one of the leaders with New York Wired in terms of advancing courses and course completions. So it's something that we really feel is a great thing.
Is there a cost involved for the program?
So currently, for the workforce development area, we paid $30,000 for the year to have licenses to hand out through our offices, which is about 500 licenses. And then going forward, they're talking about a reduction in price if we go to the universal access.
Any other questions? Matt?
Yeah, Supervisor Bramer had to step out, but she was curious for the Summer Youth Award ceremony. Is it the 16th or the 18th of August? Well, she looked in her calendar, and the 16th is the Wednesday.
Yeah, I'm sorry, it's the Wednesday.
Okay.
Yeah.
All right, very good.
That. Yeah. Wednesday the 16th, not the.
This is a nice event. I did attend it last year.
Yeah, thanks.
Standing up.
Yeah. Yeah, and we I don't want to give it away too early, but we have what we think is going to be an outstanding inspirational speaker this year too. Yeah.
You've had very good ones over the years.
Yeah.
Last year I missed. I was out of town, but I've been to every one since I've been on the board, and I really enjoy going. I think it's a wonderful program, and I'm glad that as many kids can participate as do. Any other questions? All right, if not,
Great, thank you.
thank you very much,
Yes,
Chris.
welcome.
Have a good day now. Rob, your turn. Make sure I'm not missing anything. I just want to...
One note on that, the agenda for what's
Okay, good morning, everyone.
Good morning.
I just have what I think are just a few fairly quick items. First item, my agenda is a request to appoint to the Warren County Community Services Board Christina Besson, Queensbury resident. Christina works in the Warren County Probation Department. She was previously a member of the Warren County Community Services Board, and as folks may be aware, her husband was superintendent in Granville, and so they had moved to Granville for some period of time, but now they've returned to Warren County. So she was off the Warren County Community Services Board while she was living out of county, and we would like to reappoint her. The term listed there, she would be filling an unexpired term, so that's why the term is fairly short. It would be effective July 21st, which would be the next Board of Supervisor meeting, through the end of the year. Our Community Services Board members, the regular term is a 4-year term, but when we have a vacancy, we do fill unexpired terms.
All right, would someone like to make that motion? Supervisor McDonald, second by Supervisor McDevitt. All those in favor? Aye. Opposed? Carried.
Second item is a request to amend the 2017 budget for the Office of Community Services, recognize additional district delivery system reform incentive payment program, district revenue of $8,112.19. This is funding. What we do with this funding is we just accept it as revenue and then allow that revenue to offset the county costs for our budget, our services.
Okay. Someone like to make the motion? Supervisor McDonald, seconded by Supervisor McDevitt. All those in favor? Aye. Opposed? Carried.
Okay, thank you. Then the last item I have here is just a report out, a request for authorization to attend a meeting or convention. One of our employees, Carrie Wright, is a program analyst in our office. She works closely with our various contract agencies and looking for grant writing opportunities or funding opportunities, even through the state. Some funding opportunities that become available require a proposal, and she provides technical assistance to our agencies to try to bring in additional funding for our services. Occasionally, we will write a proposal for funding directly for our office as well. So she became aware of this grant writing workshop in Saratoga Springs and requested permission to attend. The cost is a little bit higher than we would normally spend, but given the fact that it's directly related to grant writing, we felt like there could be some return on the investment. Cost was $295. It was a 2-day workshop in Saratoga. Of course, she traveled back and forth, no overnight. But there's a little bit of funding there for the travel as well.
All right, we don't have to do anything if we're all set. He's just letting
It's
us...
like a report. I think that's the policy, is
Yeah.
just to report out right at committee afterwards. So thank you for, signing off the permission.
Not a problem. Thank you very much.
Okay.
That's it? Okay, thank you, Rob.
That's all I have.
Have a
Thank
good
you.
afternoon.
Yeah, you too.
All right, Dee? Yes, Ron.
And if I'm needed in terms of a quorum on the vote, Brian, I would have voted in the affirmative.
Okay, thank you.
Oh, on that level. That's one.
Good morning.
Good morning.
Morning.
I did add 2 items to our agenda last minute this morning, so hopefully I won't have to come up next month.
Okay.
So the first item we have is permission to fill the vacant position of supervisor volunteers, grade 2, base salary $26,027.
Okay. Motion Supervisor McDonald, second by Supervisor McDevitt. Any questions? All those in favor? Aye. Opposed? Carried.
The next item, after discussions with the treasurer's office, OFA currently has 20 different listings underneath the budget, and we would like to condense it to just 2. So we would have one for Hamilton County and one for Warren County. It would make it a lot easier for us internally, so we didn't have to do a bunch of paperwork whenever we had to shift money from one area to another. An example of this was we recently had to do a repair to our freezer at the Bolton Meal Site. The money needed to come out of 6774.422, which is our SNAP budget, repair to equipment, but the monies were in 6773.442, which is our nutrition program for the elderly, Warren County, repair to equipment. So it'll just simplify things and make them a lot easier. If you look at the actual resolution, which should be the 3rd page for you guys, it'll actually tell you what would be included underneath Hamilton County and then what would be included underneath Warren County. It wouldn't affect our funding at all. It wouldn't affect the budget. It would just make it a little bit more simpler for us.
Sounds like a good idea. Motion by Mr. McDevitt, second by Supervisor McDonald. All those in favor? Aye. Opposed? Carried.
And the last item I have is permission to enter into a memorandum of understanding with SAIL, the Southern Adirondack Independent Living Center, to provide New York Connect services in Warren and Hamilton counties. We currently have a memorandum of understanding between us and Department of Social Services. NYSOFA, the New York State Office for the Aging, recently changed their funding so that the ILCs, the Independent Living Centers, now have a portion of the New York Connect funding, and they would like us all to work together. We have not actually met yet. I put out an invitation to try to get it going, but the program instruction that we have from the state states that we have to have it in place by July 31st, which is why I wanted to bring it to today's committee. There is an actual memorandum of understanding that I will provide to the county attorney's office for review once we've kind of worked everything out, who's going to do what.
Okay, sounds good. I'd like a motion to approve that. Supervisor McDevitt, seconded by Supervisor McDonald. All those in favor? Aye.
Aye.
Opposed? We must have all gotten up too early this morning, I guess.
I came in to get in.
Trouble getting these motions going. Oh, anything else, Dee?
That's all I have.
All right, thank you very much.
Thank you.
Have a good afternoon now. All right, we'll move on then to social services. Good morning.
Thank you. Very much appreciate it.
Thanks.
Morning. Yeah, she's coming back. Thank you.
Get your back fixed.
I went, and I'm going back again tomorrow, but boy, yesterday is the first time that chiropractor work on me where I...
Do you have one?
I'm hurting, but it's better.
We're all set if you are.
Okay, well, thank you for having me. I'm happy to be here today.
Well, we're happy to see you here
I
today.
know Maureen is out in sunny California,
Right.
so I'm a little jealous. So the first request, I'll just give a tiny bit of background. I believe we had just last month a resolution that was requested and approved, but the amount stated on the resolution was incorrect. The actual county share is a little bit less. So this request now is just to amend the resolution, number 183 of 2017 from May, which authorized the Council for Prevention of Alcohol and Substance Abuse for Youth Court program to reflect the local share total of only $68,820.
Right, I need a motion for that.
What do you think, Craig?
Motion made by Supervisor...
You know what?
Make a motion?
I'll make a motion.
Thank you, Supervisor Leggett,
Thanks,
second by
guys, for
Supervisor
letting me in.
McDonald. All those in favor? Aye.
Aye.
Opposed? Carried.
Okay. The second request is to amend the county budget to increase revenue and appropriations in the amount of $5,900, $5,900 to reflect the final allocation for the special delinquency prevention programs. This is 100% reimbursed, so just upping the county budget, and we're going to have the money come back.
Okay, very good. I need a motion. Supervisor Leggett, seconded by Supervisor McDevitt. All those in favor? Aye. Opposed? Carried.
Okay, so numbers 3 and 4 are related. So the first request is to, for permission to accept a donation in the amount of $20,000 from the Children's Committee of Warren County. And as you can see on the agenda, this Children's Committee provides numerous things to our department, mostly for our children in care. They also hold a luncheon for our caseworkers each year. They do provide a lot of assistance for things that we don't necessarily have in our budget. So they have money through a grant, or a trust actually, that was through Glens Falls National Bank. They allocated $20,000 to social services, and it's specifically for programs that we don't already have in place, and we're requesting permission to accept it. We've already worked with Julie and the Treasurer's Office to figure out how we're going to hold that money, and then the next request, you'll see how we're going to use it.
All right, well, let's move forward with this one then. Would someone like to make the motion that we accept that donation of...
I'll make that motion.
Thank you, Supervisor Leggett, seconded by Supervisor McDonald. All those in favor? Aye. Opposed? Carried. And now we'll go on to the next part.
Okay, so the second request portion of that is for DSS to create a temporary part-time position. We do have the title here in the agenda as Community Services Aide, although we're not set in stone on that, at an hourly wage to be determined from the funds that we have now been approved to accept from the Children's Committee. And what we're looking to do is, like I said, create a part-time temporary position to come in and assist with our services unit, specifically for parenting and other life skills.
Sounds like a good thing. Now, do the civil service enter into this?
Yes, they do. We've already been working with Civil Service Office, which is why we're going to, and I believe Amanda's been notified, we're going to come up with the appropriate title and work it into the organizational chart, although it's not going to be a permanent position.
Okay, very good. Would someone like to make that motion?
I'll make that motion and then comment.
All right, a second to that motion, Supervisor McDonald, and your question.
Year after year you expect this to be, or is it just this 1 year that new funds from the trust is, what's the idea?
I think the idea is this is a one-time thing. They've actually had this money for a while, and they've been designated only a portion of it. So they decided to give it to us for a specific purpose. I don't believe this type of thing is going to come along all the time. And it just depends on how much we utilize the person that we'd like to get into the temporary position as far as extending the money out and how much we determine the hourly rate is.
And then in the future, would that position disappear?
In the future, it would disappear. You know, we would hope that if it goes well, we can sort of utilize the skills that that person brings to the unit into our casework staff, although, you know, they're already maxed out, I would say. They do use what we call coached visitation, the coached visitation model, working with families. There are also some outside agencies that you may know about. The Care Center works with the YMCA in a healthy mentoring and parenting program. So this is going to be very specific to the families that we work with, both in preventive services and in our foster care families. for a person to come in and not just do coach visitation, but also life skills that go along with that, which our caseworkers don't necessarily do during the visit. So, yeah.
Sounds like a good thing. All right, all those in favor?
Aye.
Aye. Opposed? Carried.
I don't have anything else on the agenda, but if you have a moment, I can tell you about a few positive things that we've had going on.
Oh, I think that'd be wonderful.
Okay.
Mhm.
So we have, and Julie can chime in if you want, we just requested from the Office for Children and Family Services something that the state doesn't normally do with our preventive services unit. We do get audits every year for our child protective unit and our foster care unit. However, they don't necessarily audit our preventive services, so representatives from the state came in, worked with our preventive services supervisor and the casework staff, and we got an excellent review for all of our casework in that unit, so we're very pleased with that because we requested it just to, make sure we were on track with what the state is expecting, and we got an excellent review with that, so that's very positive.
Yes, so.
Also, you can look probably toward the end of the year, maybe even in budget time, we're expecting to get a grant of anywhere between $20,000 and $30,000 from OCFS to do programming related to sexually exploited youth. As you probably heard me talk about in trying to get our Case A supervisor, there's been a lot of work with regard to human trafficking, sexually exploited youth, the past couple of years, but actually there's an act that goes all the way back to 2008 with regard to that. So the state is really focusing on that, as is the federal government, and they want all of the counties who haven't yet participated in specific programs, Warren County being one of them, to start doing some programs with regard to that. So the commissioner got on board with that, and we are going to be doing that in 2018. We're not exactly sure of the funding yet, but it is going to be funded from the state, and we have to come up with a program. It's basically going to be public awareness, education, and information with regard to services.
Good. Sounds like a good program.
Yeah. So those are just a couple of things. Also, this month is, as in April, was Child Abuse Awareness. May was Mental Health Awareness and Foster Care Awareness Month. This month is Elder Abuse Awareness Month.
Oh, okay.
We actually had our Adult Protective Services Supervisor and Senior go to the Warrensburg Public Library to hold a presentation, and that was through the SAIL group. So we hope to have a little bit more outreach in that regard this month.
Okay, good. Well, it's nice just having a little update. Gives us a better idea of what's happening within the department, so I appreciate you doing that this
I'm
month.
very proud of everybody that we work with, so.
That's good to hear. I guess then it's Edward's turn.
Okay, very good.
Can I ask Julie
Go ahead.
a question? Julie, on the finances, it looks like it's a little slower this year, expense and revenue, or?
Both. Unfortunately, we're waiting on some contracts. We have several
But
bills.
we're still okay, right?
We're good.
Okay, thanks. It just looked like it.
We're good.
Cool.
That's all right.
Good morning.
Good morning.
I have one action item here this morning. On August 1st, our contract with Mahoney Fire Alarm is up for renewal, and basically this agreement provides for two services. Number one is actually two annual inspections, and the other is the overall monitoring of our fire alarm service. And I believe the cost breakdown, I believe it's $1,100 for the inspection, and then the monitoring would be about $85.50 per quarter. So a total cost of the contract is $1,442, and I believe that would be coming from budget code A.6030.437. So I recommend that we renew the contract with Mahoney.
All right, Would someone like to make the motion to get it on the floor? Motion by Supervisor Leggett, second by Supervisor McDonald. Comments, questions?
Right, there was, a couple months ago, a recommendation to upgrade. Does this fit into that at all, or how's that?
Yes. Well, I have to say, we've had no problems. Over the past several months, it's been functioning fine. It is aging, it is beginning to degrade a little bit, but nothing major. So it is functioning very well.
And so if you think there's something that needs to be done, you're going to look at it putting in the budget for next year, right?
Yes, yeah.
That was my impression from before.
Right, exactly, yep, yep.
All right, any other questions? All right, all those in favor? Aye. Opposed? Carried.
Okay, and the other item I have, the admissions and discharge report for May. We did have 3 admissions and 1 discharge. So currently we have a total of 32 long-term residents. We did have one in our daycare program, but she's in the hospital with pneumonia. In fact, some of our staff are still getting sick with pneumonia, but the family intends to bring her back sometime in the next 2 weeks when she's better and is discharged. And tomorrow we do have a planned admission to our daycare program. But as of today, we have 32 long-term residents.
Okay. Anyone have any questions?
I just,
Go ahead.
The bike week went fine, no issues for the home with bike week? No, it went very good. There was a lot of traffic, but everyone was able to get to work and get home okay. I don't know, we encouraged some of the residents to go across there for the activity to see some of the events. I don't know if they did, but they watched them. Several of them watched them from our...
Anybody ask about the glamping? Did they ask about all the tents?
The tents? Well, they've been talking, no, not really.
Okay.
No, they just enjoyed the scenery, and but there were no issues there at all.
I didn't see any Harleys coming down the road from there.
Yeah, well, I don't know. There were a lot of them there, and like, of course, in Lake George, and kind of noisy, but the noise didn't seem to bother anybody, and everything went very well, and they were kind of glad to be able to go out there and see some activity.
Yep.
Other than the deer running by,
Very good. Mr. Conover.
Thank you, Madam Chairman. Just a question on resident population, your thoughts on that going forward.
Yeah, that is a challenge. We've been working on it. I'm still, getting acclimated to the overall operations, and I really haven't been able to devote the time that's needed, or I feel is needed to really work on that. I did discuss a little bit with Mr. Sokol. I have been out and I have approached a lot of the health centers. I've gone out and given presentations to North Creek, Bolton, Chestertown, a couple other doctors' offices in Glens Falls. So we are getting the word out. We had 36 in January, and now we're down to 32, and the main reason for that is we had 4 discharges in April. That was much higher than normal because the average monthly discharge rate is about 25. So when you have 4 in 1 month, it makes a big hit. So we are getting the word out as much as we can. We'd like to bring these people back in for a tour to meet our staff and to kind of, cement the relationship. Most of our referrals are kind of word of mouth. Someone who knew someone who worked there, who lived there. From what I hear, the home obviously has a very good reputation, so that word of mouth is beneficial. I've also heard that there's a big demand up in that area and even north of us for daycare. So we are promoting that. We do have openings in our daycare program. And sometimes, they like it so much they want to live there full time, so that's kind of a lead into that.
How many do you have in your daycare program presently?
Well, as of today, none, but we have 1 planned admission tomorrow, and then we have the one in the hospital that's planning to return in 2 weeks. Yeah. So, we do need to do a lot more. I have a lot of ideas, but, we've been dealing with a lot of things lately, and but that is, it is of paramount importance, and I think, we do have a lot of assets there, and I think it's just a matter, because I'm hearing a lot that a lot of the people, even the local people, they really don't know a lot about us. They don't know what services we offer. They don't know we have respite. They don't know we have daycare. They're just not aware of it. So community education is a big part of that, and I obviously need to spend more time doing that. As I say, I'm getting acclimated to a lot of other things I need to get my hands on, and I'm getting there. It takes a while, but I'm getting there. But community education is very important. One of the things that's particularly frustrating in the past month is out-of-county applicants. For some reason, many of the other counties are not willing or not able to pay us the full amount of the temporary assistance. I think Essex was only willing to pay us like 40% of our charge. An applicant from Schenectady County, we were told by them that the applicant their income is too high to qualify for temporary assistance. And right now I'm speaking to someone in Washington County. And the irony is that all these people, they want to come to our home and they're medically, appropriate, but we just can't get the financing. So, I spent a lot of time, interviewing, taking them for a tour, getting all the clinical information, getting all the forms in order, but then in the end, the financing falls through because of the out-of-county lack of funding on the part of other counties. So that's been particularly frustrating. I'm really, at this point, I'm really not sure what to do about it. I think I have to research it a little bit more. But there is a demand there. Not everyone is clinically appropriate, of course, for us, but there is a demand, but I think just a lot of promotion, community education, making people aware of what we have, making them also aware of maybe how we probably could be a better option for them than maybe another option they're looking at, maybe another home that's not as good as Countryside, maybe home care that might not provide, the round-the-clock service that we have. So it's that education and the promotion, and it takes time, to build relationships and to get those good referrals, but we'll just keep plugging away.
I think though that will work if the occupancy is going to fall below our projections, our budget projections, from the revenue point of view, and the expense point of view, which would be both after all. Any information you can provide us on that? I don't know what the projections of the budget was based on. Looking ahead for this year, I assume it's based on historical experience. But if that historical experience is going to be impacted, assuming you could let us know better.
Okay, all right.
I was just wondering, do we have anything at all on the website that tells about Countryside? If not, I would think we should have a good write-up there, wouldn't you, explaining what the services are, what we can provide? At least it's one way for people to,
Right.
check into that.
Yeah, but when I was interviewing for the job, I did check out the website, and there was some information
Okay.
there, and it was kind of like they had a video there of some of the activities.
Okay.
So yeah, we do have that. I'm not sure. I'm not sure that we have all of our selling points or assets focused there, what people are looking for. So it might need to be updated. Although I'm still not quite convinced that this generation utilizes social media that much to buy this type of a product. It's more like, the referral from the doctor,
Right.
or my neighbor's aunt was there. It's that word of mouth kind of thing that still kind of prevails a little bit. But going forward, yeah, that's something we need to look into.
Our maximum resident population is
48. Right, and right now we have 32, yeah. So
Down.
we are down, again, because of a tough April there. But we'll just keep working on it. And, we have a lot of ideas. There's no shortage of ideas or strategies. It's just, really committing the time and the personnel, not, lack of a better word, to kind of sell the home, and make people aware and go through all the steps that's needed to apply and get everything approved and get them in.
All right, and you've also been there a short amount of time, so you can only accomplish
Right.
a certain amount in those few months. So it is something that's going to be an ongoing thing.
Right.
Mr. Conover?
Yeah, thank you, Madam Chair. I think the department should consider the fact, you have a home to run. It takes a lot of your time, but it would seem to me that some thought should be given to how to direct the resources necessary to maybe do a better job communicating. I'm not exactly sure how that would be, whether that would be through assisting staff or through some service providers and consultants. I'm not exactly sure at this stage, but I think that some thought should be given to that going forward. otherwise we may, with the best of intentions, languish a little bit simply because there's only so much time to in the day to do things. And in any event, I think that there should be some communication with your colleagues on this and come to Kevin or me or Edna with any suggestions as to what you think isn't being done, that should be done, or could be done.
Yep, good point.
One of the things I'd like to mention is the case management position had been put into the budget under contracts, which we did not do because the numbers are down, and we know we need to keep the expenses down because the revenue is going to be down. So, we are anticipating trying to keep the expenses down, at least until the numbers are up. Another thing that you came to us with this month is he has collected some donations. And with that, he has some great ideas as far as getting the residents out in the community, going on the Minnehaha, going for ice cream, doing different things. And I think that helps sell as well. When, like for me, I have an elderly mom, and if I'm seeing residents out doing things, if it came time for me to look for somewhere for my mom, those are the kind of things I would remember. So I think you're really trying to work in the right direction.
Yeah, a couple of the family members of some of our deceased residents were very happy of the care they received. So in appreciation for that, they did make a monetary contribution, which we did put in our activity fund to expand the activity program, taking them for boat rides to the museum in Warrensburg, the fish hatchery, maybe apple picking in the fall, a lot of different things for that community presence. And then hopefully they'll tell their families, and their families will tell their friends, and the word will get around. Again, that kind of free word-of-mouth advertising. And also, too, since the families are very happy, what we've started to do is we started to ask some of the residents and their families if they would be willing to write a letter of recommendation for us. And as of today, we do have one. That is from Mrs. York's son, Bud York. He wrote a very nice letter of recommendation. So we do have that in our packet to be able to give to prospective admissions. As they say, there's no better advertising than a satisfied client.
Right. All right. Any more discussion, or shall we? Go ahead.
Just one other positive point is that we were able to hire someone for the institutional aid position, a very good candidate. She's young, she's energetic, she's very good with the residents, she lives nearby, and she's willing to work all shifts, including 11 to 7. So we're very pleased to have her on board. So thank you again for approving that position. So right now we have a real good team. I think that's our greatest asset that we can promote. We have a mix of the veterans who've been there a long time and know a lot. We have some new people with new, fresh ideas. So it's a good mix there, and we'll just work our darndest to try and keep it that way.
Okay, good. Thank you. Cynthia, what do we have next? Is it Julie's report?
Okay. Well, we already talked a little bit about the expense and the revenue.
Right.
They're both down a little bit, but as of
Why
right
did
now...
you say that was something about contract? Is what?
A little bit behind.
Yeah, we're still waiting on some contracts, and until we have them and they're fully executed, we can't make payments.
Right, okay.
So we are holding several payments to a few different vendors. So once they're paid, I think our expenses are going to be pretty much on target. So hopefully, in turn, revenue will be as well.
All right. Do any of the committee members have any questions for Julie? We good? Okay. Thank you very much.
Thank you.
Cynthia, thank you. It was nice having you here today. Edward, I've got to stop by. I haven't made it up there yet, but I'll get there.
Shrug. Nothing like that. If that's it. A lot of big books there.
We're all ready. It's ready. We're going to have an encore. I'm telling you, would you, one of you do something so they'll forget? Please?
Claudia's also...
We got money from them.
She's pulling out
Another
somewhere.
$7,900 for us, and $4,000 for community service, so thank you very much. We're up to about $45,000, so that's good. I can't say it was worth that half hour, but of your lives that you will never get back. I know.
Yeah. Sent us today? Is the same thing?
Yeah. It's painful.
She had the babies already.
She did have the babies?
Yeah, I just found that
Thursday
I
night.
hear ya. You know,
after that board meeting on Wednesday, she said, I can't.
the woman that did it,
Good for her.
said
Girls or boys?
she
Two girls.
recorded it as she's sitting on her couch.
That's
So she
great.
just read
Oh, yeah.
like Medicaid said she had to do.
Thing, but it's a lot of work.
Gotta go to his own
It's a
defense, can't play
horrible-
man-to-man anymore.
Horrible thing.
Good morning. How are you? Take care.
We have enough people.
They're on their way back.
To the year compared to the year before. Because if you look at April compared to April, we're actually up. So that would take you up.
But she's fine to be.
Compared to the
Okay, we're off that path.
right runner and different.
Okay, good morning, everybody. We have a couple of additional late-breaking agenda items here that we would like to add that hopefully won't take up too much time. The first thing is to authorize a contract with Chantel Grenier to provide occupational therapy services in a form approved by the county attorney. I didn't put her on with the initial stuff because she hadn't given in her malpractice insurance yet, so till we have everything we need to go, we don't put it on, but she came through yesterday, so we're ready to request that.
Okay, are we waiting on Matt, or can we, otherwise we only have three of us, but,
Yeah, do we have quorum?
yeah, all right, she's gonna just check, because we can't.
That is not our code. She's just-
Oh, he's not? Wait a minute, who?
that's it.
McDonald.
No, McDonald.
Okay.
He's on it, yeah. Because we're short two anyway, so. All right, I'll just let Pat tell us again what it is that we're going to be acting on, okay?
Okay, we had a couple of late breakers here. One is to authorize a contract agreement with Chantel Grenier to provide occupational therapy services, and they're reimbursable services, and she hadn't given in her malpractice insurance yet, so we weren't able to put her on the transmitted information, but we didn't want to wait another month.
All right, so I need a motion then to authorize that contract agreement. Motion by Supervisor McDonald, seconded by Supervisor McDevitt, or yeah, right, Leggett. All those in favor? Aye. Opposed? Carried.
Okay, then we just thought we'd give you a little short synopsis of the recent information with the measles. Janelle worked very hard all weekend, so I want to be sure we give her lots of kudos, because she was on the phone a
It
real
sounds
lot.
that way, absolutely, yes.
So anyway, luckily, it hasn't been quite as busy as we thought it would be, but knock wood on that. So Janelle, if you want to just...
Sure. So, if you don't know already, we had a positive measles case, which is pretty rare in our region of the United States, in addition to our state, in addition to our counties and our neighboring counties. The last big excitement that we had with measles was 1992, when Pat got to spend all the endless hours there. It was in a Saratoga County resident, and the unique piece was that this resident was also an employee in Warren County. The exposures, fortunately, were limited to 5 locations between the 2 counties. 3 of them were in our county. 2 of them were in Saratoga County. Very specific days, very specific times. Because measles is entirely very contagious, we decided that we wanted to look at a window of 2 hours before the exposure to 2 hours after the exposure, because it's spread airborne. So we worked very hard with Hudson Headwaters, with the Warrensburg Health Center and West Mountain Primary Care, and the Hudson Headwaters Administration Building, to identify all staff and patients that have been exposed. That was Friday night's task. Saturday, Hudson Headwaters called in a team of people and made all their verbal notifications, provided education as far as what the symptoms are, encouraged, people to call if they experience those symptoms so they could be directed to health care, so that we could be prepared when they went to a center, so that we could take the necessary precautions. The State Health Department, Warren and Saratoga counties, in addition to Hudson Headwaters, worked very diligently to try to cover all the bases. One of the things the counties did was also notify all of our medical providers, because what we're looking for and surveillancing for are secondary cases. And we were right at the window where secondary cases are going to start experiencing symptoms. So that was why the urgency over the weekend, because we wanted to make sure everybody knew what to do if somebody walked in with a fever and a rash. So as far as exposures, the health center notified their staff. They verified all their immunity results. Thank goodness they're a health center that has state regulations that require immunity to the MMR and reporting of that. So their staff were not at risk, but they reviewed and made sure. In addition, they found that 46 patients were at risk. 9 of them had chronic diseases that they're actually following up with this week, just to ensure and double check and make sure they didn't have any symptoms that presented. And basically, they also double protected the notification by sending out letters. They sent out 500 letters this week of all Warrensburg Health Center patients and the West Mountain primary care patients that were there in the morning. So I believe due to the diligent efforts of all involved, especially Hudson Headwaters, the calls have slowed down. We haven't gotten as much as that we had anticipated. And I just can't say enough about how much I appreciate the collaboration and communication. It certainly made a challenging situation better. We did make notifications to Chairman Frazier and Mr. Garrity and also Mr. Conover.
I think you did a great job with that. I certainly appreciated getting the call and being updated on what was going on.
So thanks, Jill. Anybody have any questions?
So at this point, then, everybody's notified, all the,
Right.
so now it's just kind of wait and see. But
It's a wait and see, but a happier wait and see now, because today's the 20th. And it's been 12 days since the last known exposure in our community. So if people haven't come down with symptoms by today, chances are more unlikely that they'll come down with symptoms later. So
We didn't even have as much of the worried wealth that I would have anticipated. I came in yesterday expecting the phones to be ringing off the hooks, and I just had one lady that called me a bad name. But I thought that was pretty good. Not that she called me a bad name, but anyway, she was visited the health center 2 months ago, and she was distressed that we weren't more concerned about her. So anyway, we were happy just that she was the only disgruntled. Moving on, the budget transfer and budget amendments. Todd, you want to review those?
Attachment 5 are our budget transfer funds. The first one that I've asked for $5,000 is that we have a part-time person who is taking over some of the responsibilities in our child find program. And when she just went over to that program to help out some hours during the week, we needed to transfer the money to help pay for that under the part-time. So we moved money from full-time to part-time salaries to cover that. Hopefully, my guess is till the end of the year, so we should be okay. Our second request is our bioterrorism. We have a maintenance agreement on the fit test machine, I believe it is, that we have to do every year. So I had to move some money from our part-time salary line there to the maintenance agreement to pay for that for this year. Those are the only 2 budget transfers I have. On budget amendment, which is attachment number 6, this is our DISRIP. Again, we got some funds in for $7,905, so I'm just asking to amend the budget to accept those funds that we got in. Tammy can maybe better explain a little bit, I guess.
Well, yes, because this is tied into that video that you all want to see and Mr. Sokol wanted to see again. So we'll set that up for him. Again, I know how painful that was. It was a Medicaid requirement. We had to sit through it, and because of that, we can continue to receive the funds that are flowing through the DISRIP project. So I thank you all very much. This is a result of Every quarter, we're required to do certain reporting. We receive funds for any patients, any Medicaid patients that we have in our program because we're doing medication reconciliation, things like that. Community service, you'll see, also receives some monies for the projects as part of district that they're involved in. So it is a worthwhile, and hopefully we can affect some change and provide better, not that there was anything wrong with the care, but a more collaborative care for the patients in Warren County.
Okay, so we need to act on that one then.
I think there's two, you have to do
Where
one
we
for
put-
each one for the
Well,
budget
that's what-
amendment.
what- Okay, would someone like to make the motion and put those two in one motion? All right, Supervisor McDonald, second by Supervisor McDevitt. All those in favor? Aye. Opposed? Carried.
Okay, thank you. We would like to request a resolution to authorize an agreement with Lexikey Learning to provide software and related equipment for educational purposes for the WIC programs in a form approved by the county attorney. And Mary is not here today, but I will say we did run that agreement by her before she went out, and she did a lot of work on it, but I think it's set up now, so we'd like to thank her. And it's something that the state wants. It's reimbursable. I think probably if we were in another area that there were a lot of different languages, it would be more helpful, but it's one of those one size has to fit all. So that's where we are with that.
All right, someone like to make that motion? Motion made by Supervisor McDevitt, seconded by Supervisor Bramer. All those in favor? Aye.
Aye.
Carried.
Okay, it was that time this year that we needed to put out a bid for transportation services for our special needs children that are enrolled in preschool and early intervention. So we would like to award the bid if you're agreeable to Durham Transportation. They were the only bidders. Their price was $49.90 a day, plus $200 a day if a child is wheelchair bound. We have to have an agreement for wheelchair bound. Normally we don't and haven't had any in the last 3 years. We currently have one. But that child, I believe, will be going to kindergarten in the fall, but we still need to have the agreement in place. So you can see that for the past 3 years, because it's a one-year contract with the ability to renew for 2 one-year additional terms. So it's now going to be, they're proposing $49.90 a day as opposed to 3 years ago, $44.55. I don't see that we have a lot of choice, and we've worked...
You only got one bidder. Right.
Yeah, we've worked with them, and it's like every other thing, we have our ups and downs, but they've been, I would say, fairly cooperative.
So then would someone like to bring that to the floor? Supervisor Leggett, second by Supervisor Bramer. Any discussion? All right. All those in favor?
Aye.
Aye. Opposed? Carried.
Okay.
Thank you.
We'd like to request a resolution to make a contract with Catherine Mealy, who's a registered dietitian, to provide nutrition services for our CHA. Nutrition services are reimbursable, and we need to have somebody to provide them because they're listed on our state operating certificate.
All right. Someone like to make that motion? Supervisor Bramer, seconded by Supervisor McDonald. All those in favor?
Aye.
Aye. Opposed? Carried.
Now, I'm sure that if you enjoyed the DISRIP talk last month, I think that you'll know that what we gave you, the annual report, even though it was lengthy, is more exciting and certainly easier to understand. So I did transmit that to everybody, and I'm sure you all have had a chance to read it, but we do need to accept it by resolution. And if anybody didn't see enough on their computer, we also have hard copies to offer for anybody that would like to have one. They're right down there.
Okay. All right. Would someone like to make that motion to accept the annual report? Supervisor McDevitt, seconded by Supervisor Leggett. All those in favor? Aye. Opposed? Carried.
We really don't like to, I shouldn't make fun of it in any way because it's a really lot of work. And it's our one time of the year that everybody gets a chance to see what their own efforts have done. So, with that said, even though it's lengthy and kind of funny, it's not really funny. It really is an important document. And a lot of people actually call us during the year. We just don't make tons of paper copies anymore. And it is on our website, or will be, when it's ratified by the full board.
Okay.
Okay, moving on, we would like to request a resolution to appoint Dr. Paul Bachman as our medical director for the Division of Public Health. and appoint him also as a member of the Professional Advisory Committee. Dr. Bachman will be replacing Dr. Larson, who will be retiring as of July 1st, and we're sorry to lose him. He's been with us for a lot of years. He even goes back to, he was with us back in 1990 when we had the original measles, so he's been around. So we thank him for his service. And right at the moment, Dr. John Ruggie will remain as our medical director for the Division of Home Care. There won't be any financial changes, or the contract will stay in place, but we do need to put a different person in place.
All right, would someone like to make that motion to appoint Paul Bachman? Supervisor McDonald, seconded by Supervisor Bramer. All those in favor?
Aye.
Opposed? Carried.
Okay, we don't have any pending items. Moving on to information for discussion and review. Ton, you want to talk about expenditures and all of that kind of important stuff?
Attachment number 2 are our financials that were as of June 12th. Again, even though it's halfway through the year, a lot of our big programs, which are the preschool program, a lot of that stuff's not billed till the end of the year, but you get an idea of where we stand. You'll see our salaries again. Happy to say that we're still under budget from last year, or under actual, I should say, by $111,000. And we are 35.89% of our budget this year, and last year we were at 42.61, so quite a difference. Again, majority of it is in our regular salaries, which is our nursing program. Most of the people that have come back and we're still working for us are the per diem, so that's under the part-time salary line, you see, and that's why that's up. And our regular salaries right now are down based on that, but Val's been getting a lot of new people and other people are going to join us. So that hopefully will start trending a little bit differently. Attachment number 3, which is our comparison this time last year to this time this year. You'll see we're slightly under in our contractuals. We've kind of caught up with our preschool program now with getting those invoices. We have to wait for approval from the state, so now that those have come through and we've got those in, and the end of the school year for preschool is the end of this month, so we're trying to get everything updated and caught up there. And our revenues are, for the first 4 months of the year, comparing each other, we're down slightly overall. And again, we don't have to compare last year. We had our long-term care program up until about June of last year. So now you're going to start to see that start to match a little bit better, because our long-term care, I think our last patient was
May 30th.
the end of May. Yeah, May 31st last year. So we're still hanging in there. We're still doing well. Our equipment is slightly up because we were able to purchase 2 vehicles. We got another Jeep that we need for the North Country, especially when it's bad weather and muddy weather and all that. So we've got a Jeep in the fleet, another one, and a regular car. And that's it.
Carol, do you guys have one of the hybrids in your fleet?
We do not.
You don't? Okay.
Yes, Mr. Leggett.
So, the per diems are working out okay, both financially and coverage-wise?
Probably per diems if they could decide they don't want to be a per diem at any time. But luckily, we've been really lucky so far for the last couple of years, and we're hearing maybe a couple of them next year might not want to, but by then, got a couple of other people that are talking retiring and will come back. So I can't tell you for sure it's always going to be fine. I mean, we'll get to staffing in a minute, you'll know what I mean.
Don't want to rush you there.
On attachment number 1 is our emergency response and preparedness report. I will say we have our Kaplan University student who's doing an awesome job. She's helping out a lot with health ed and with doing our social media, and then she's just, these younger people that are coming in have a whole lot of skills to offer that are really wonderful and really
Terrific.
and not be understated. But she's great, seems to like us, we certainly like her.
Oh,
so
that's wonderful.
that's a good thing.
Right.
She's great.
Right.
But, okay, moving on to referrals, Val and Tammy, do you want to comment on attachment number 4?
We really haven't had much change that's going on. We're steadily busy. If you compare the percentages of, we're -4%, where last year at this time we were -13%.
and those just kind of depend on how many people are discharged from the hospital, what services do they need. As of late, a lot of times our liaisons will call us in with a referral, but by the time the patient's ready for discharge, they've gone to rehab as opposed to, going home. So they'll go to the rehab centers, and then they'll hopefully come back to us, at that time.
Yes.
Verity.
Is there any way that we could get the figures for the CHOP before the state opened it up to everybody to bid on the, when did they do that? Was it 4 years ago that they opened it up to other agencies?
Yeah.
Because I know you only show 4%, but where were we 4 years ago?
Yeah, we can do
The
that.
amount of, that would be interesting to see, because I get, with the competition out there, we have to do everything we can to keep it, to keep...
I think one of the things about the competition is, as compared to 4 years ago, there's a lot more people having home care now. And is it possible that there's business for more than one agency? Yes. The problem is getting staffing for all of the agencies.
Well, that's my problem, though. We need to stay on our toes, because this, is, it's good for the county, and you do a wonderful job, but there's a lot of people out there nipping at our heels to want to take over our patients and our business. So I'd be interested to see where we were prior to them opening it up and where we are now, and I'm pleased to see that compared to last year, we're holding our own. But it still does concern me, the rumblings I'm hearing that people were under attack. Basically, they want to get the Warren County CHOP business. So
because we're good, and they know it. And I don't mind being on TV. I really am.
That's all well and good, but let's not wait till it's too late, and then all of a sudden we're in crisis mode. I stay on your toes, and I'd like to see the
Well, we're
numbers.
certainly happy to set up a meeting with you. We can bring our annual report data from the last couple of years.
Yeah, I just would like to see where we are compared, because you have such a great service. So.
We'll give you every information that we have.
Thank you.
Okay. Anybody else have any questions about it?
Those big books are UASNY.
Oh, Val, here you go. We were just talking about that.
UASNY. What's that stand for?
I can't even, it's kind of like a uniform tool that's used, it's basically for nursing home placement. And they have to meet, certain criteria. It becomes a scoring. Our nursing, our CHOP patients that we carry in the home care division, the tools that we use is an OASIS. It's the outcome-based assessment tool, where for the Medicaid population, looking for whether it's consumer-directed aids, that totally deals with Medicaid and nursing home. It's just a universal tool. And we had been doing a few more UASNYs, but a lot of it's related with the MLTCs, giving patients more time to have home health aides or personal care aides in the home. Not everybody is doing them correctly. Because some of them are being done by licensed agencies, and it would help the licensed agency to recruit more people, into those programs.
Into a long-term program.
Yes. Okay, moving on to Mr. Leggett's topic here now, staffing update. First, we have a request that we'd like to fill a nurse technician position, which is our LPN. A couple of years ago, we had one LPN retire, and we did replace that position, and we've only had two anyway. The second one has given us notification she's going to be leaving the 1st of August, but plans to also stay per diem. But we would like to backfill that position, which is a little bit of change from our initial plan, mainly because nurse techs are much easier to fill, and they can help out a lot with like wound cares and that kind of thing, and don't have to do the full assessment, so they can be really productive, do basically more. And the visit reimbursement is not any different. So it would be worth us to do that. Plus the fact we anticipate we won't be having any problem filling that particular position. So if you're in
If
agreement.
there's any problem with that, with the backfilling, I know we had that big discussion yesterday, I just want to make sure. All right,
Bring it to committee.
okay, so,
It's that committee, right? Do I need to do something else?
No, just
no,
committee.
we need to make a motion then to approve that, right?
They just
Or
endorsed.
did I just-
Yeah.
Okay, she's got the notice of intent to fill right there.
Right.
We just got it afterwards, so it's not in the packet, but it is right there.
Okay, but we need to make the motion to approve it, is that?
Yes, you do.
All right,
I
so,
beg your pardon?
Can you pass that over for us to take a quick
Sure,
look?
Let's
absolutely.
just take action then.
right, we need a motion to approve that, the backfill.
Yes, I'll make that motion.
All right, a second to that, Supervisor McDonald, they just want to take a quick minute, I guess, to look it over.
But the other one that we have is a request to,
All right, all right, I just want to see if they need that much more time. Could we take a vote on that? Do you see a problem with that? All right, all those in favor? Aye. Opposed? Carried.
okay, could I just for clarification, now going forward at committee, I should transmit all of this if we're going to ask, is that's what I'm supposed to do? Okay, all right, because what happens is, when we send it to civil service and then it comes up here, it gets all of the signatures, we're not always sure where it is in the process. So,
What you can do, and a lot of other department heads do, is just put the blank form that you send up, make a copy of that before you give the original to Jackie. You can put that blank one in, so at least it shows your information. It won't have all the signatures in it for your agenda, but at least
okay, so
it'll have
just like the
that.
top part that I fill out?
Yeah, that's the part that they're interested in, is what the position is, the salary.
Oh, okay, I can do
At least
that.
you can
That's no, I'll play the game, just tell me the rules. Okay, the second thing is, the WIC program. We had two positions, a part-time and a full-time to do for WIC nutrition facilitator. And we had the full-time person that we had resigned during her probationary period. So the person that was working part-time stepped into the full-time position. That was no problem. It was less than 6 months. So we looked to recruit a part-time person to backfill that position. But because the intent to fill form was like 1 week over 6 months, I had to go back through the whole thing. So that's where we are now. We have a person that's that we could bring on, but we need to have permission. We had to do another one of these. So that's where I am.
All right, so would someone like to make that motion for approval to fill the position?
I'll make the motion.
All right, second to the motion, second by Supervisor McDonald. Any discussion? All those in favor?
Aye.
Aye. Opposed? Carried.
Okay, and that was the first thing of the staffing update.
Mhm.
And I didn't put the form because I thought I was just telling you that we were going to backfill the position. I didn't realize everybody was going to be so right on. Okay, and so that's really all there is with that. We still have a couple of open nursing positions. We continue our recruitment efforts. One of the nursing positions, oddly enough, she resigned a couple of months ago, went to a neighboring agency, and she's wishing to come back.
Oh,
So I still have her form that I haven't sent up yet because I don't want to, now with the 6-month thing, I don't want to have it too long. So we'll have to do intent to fill, and it'll be her old position, so we'll do that. But it's interesting that the pastures are not always as green as they are. Moving on to other news, our rabies program, our new plan for managing animal bites is going very, very well. Pat Belden and Janelle did a very nice orientation presentation for some of the animal control officers.
Great.
And we have worked with civil service, and they've been really good about accommodating, like after-hours things, so they can come in and get their name badge, and that's worked out well. So we are more than cautiously optimistic that that's going to work out.
great.
Very
Happy to
nicely.
hear that.
Regarding just an informational thing, recently one of our long-standing patients passed away, and the patient's wife requested that any memorial donations would come to, which doesn't usually happen often. They go to the SPCA and they go to different other places. So this particular one, actually, we got in, as of day before yesterday, or last week, we got in $735, but yesterday we received another $50, so we've gotten in $785. And the good thing about that is the patient was long-term, and he was seen by a lot of different nurses. So that's kind of nice that when that happens, that the nurses see that somebody appreciates their efforts. And on that happy note, that's all I have.
All right, does anyone from the committee have any questions? Anyone from the audience have anything? All right, if not, then I'm going to entertain a motion to adjourn. Supervisor McDonald, second by Supervisor Leggett. All those in favor? Aye. You are adjourned.